Here you've got the practical issues and skills. And the first one, we've got the lumbar puncture. You have to know, you have to describe, present the typical site of lumbar puncture, all structures on the model and or on yourself. The cranial nerves know and present the sites on the brain and exit, so the foramens. So I hope you remember this one. So mandibular foramen, for example, oval, rotundum, mental, on model and or charts. The cerebral arterial circle, the Willis circle, describe main branches and clinical significance on the model. Okay. Ophthalmoscopic photograph of normal eye fundus. So the fundus recognize if you've got right, if you've got the left, and describe what you've got on the fundus on the chart. Okay, so if you've got this, what you've got here, what you've got here, arteries and veins. Okay, so you have to describe when you've got temporal aspect, nasal aspect, so medial lateral. You have to describe on the chart. Otoscopic examination, the same. If you've got the membrane, you have to describe what you've got in these aspects. Okay, so the anatomical principles. How to reduce the curvature of external acoustic meatus on yourself. Okay, so you've got the concha and what, and here you've got the meatus. How can you reduce the curvatures? The meninges of the brain and spinal cord, intermeningeal spaces. So what you've got between the meninges, the structure, terminology, and contents of this spaces on the natural specimen and or on the chart. Okay, and this one, the topography of the cerebral hemispheres. Point and name the gyri, salci, and Brodmann areas on the cerebrum, on the chart or on the model. Okay, so if you've got the model, you have to point with what you've got here, what you've got here, what you've got here. Okay, so point and name the gyri, salci, and Brodmann areas on the cerebrum. And the last one, the circulation of the cerebrospinal fluid. Describe the ventricular system of the brain and the drainage of the CSF. Okay, so if you've got fourth ventricle, here you've got the third aqueduct and fourth ventricle and the central canal and the circulation of the fluids on the chart and or on the model. Okay, so and the end. Thank you for your attention. Okay, see you.